Okay, well, good evening, everyone. I think most people have joined. We're still waiting for a few more people to join, but we will get started. So, good evening, good afternoon, wherever you are based, and welcome to today's webinar, an introduction to NCDs and NCD policies for non-medical advocates. Thank you for taking the time to join us. You could have been anywhere this evening, and you chose to be with us, and so we really appreciate that. My name is Abby Bejo, and I'm the program director at Lake Health and Wellbeing, which is a public health NGO based in St. Kitts and Nevis. And our work focuses on improving the health and well-being of our local, regional, and online communities. And we do that in a number of ways, through research, through advocacy, through public health interventions, and health education. So today's webinar, we're pleased to say, is a collaboration between us, Lake Health and Wellbeing, and St. George's University through their practicum program. And we've been really fortunate to work with a dedicated group of practicum students who have taken the lead in organizing this session as part of their practicum. So they've worked extremely hard on the planning, the content, and coordinating today's webinar with leadership provided by Jay Robinson, our project assistant. And it has been such a pleasure to work alongside our practicum students. So the topic for this session was suggested by the Nevis Renal Society, one of our partners, and we're very grateful to them for highlighting the need for accessible, introduction to NCDs and NCD policies for non-medical advocates. We know there are many advocates out there working on NCDs, but maybe don't have the medical background and sometimes they can feel not too confident in talking through some NCD issues. And so we hope that this webinar will address some of those issues. And we think this is a really important area to support effective community and civil society engagement. So I am not going to say too much more. So with that, I am delighted to hand over to the St. George's University practicum students, Sam and Maggie, who will be leading today's session. So thank you again for joining, and we hope you find this webinar informative and empowering. So over to you guys.
Hi, good evening, everyone. Welcome to our webinar, an introduction to NCDs and NCD policies for non-medical advocates. NCDs. Sorry, can everyone hear me?
Sorry.
Oh, okay. NCDs stand for non-communicable diseases. My name is Dr. Samuel Greenberg. I'm currently an MPH candidate at St. George's University.
And hello, everyone. My name is Dr. Magdalena Jankowski, and I'm an MPH candidate at St. George's University. Thanks for joining us today, and we will be your moderators for this evening.
We're truly honored to be here and grateful for the opportunity to speak with such passionate advocates and community leaders. We'd like to extend a sincere thank you to Lake Health and Wellbeing for their mentorship and for inviting us to be part of this important initiative.
Partnering SGU with Lake Health and Wellbeing highlights the power of collaboration between community organizations and academic institutions in creating both meaningful and lasting impact. Over the next hour and a half, you'll hear from experts in public health, oral health, and advocacy who will walk us through one, what are non-communicable diseases, two, why NCDs have become one of the most urgent health challenges in the Caribbean, three, how ordinary community members, not just healthcare providers, can influence prevention, policy development, and positive change, and lastly, what you can do in your own setting to strengthen resilience and promote healthier futures. By the end of this webinar, our goal is that each of you feels equipped, empowered, and included in the conversation around NCD prevention.
So before we begin, just a few quick housekeeping notes to support an accessible and comfortable experience for everyone. There's closed captioning available through the webinar. Please feel free to use the chat to share any comments, ask any questions, or request any tech support at any time. We'll also be including screen and comfort breaks so you can stretch, hydrate, rest your eyes, whatever you want to do. And the webinar is being recorded, and both the recording and slides will be posted to the Lake Health and Wellbeing website and YouTube channel, which will be linked at the end.
So let's welcome our first speaker of the night, Dr. Kerry Mitchell, Assistant Dean of Student Affairs and Chair of Public Health and Preventive Medicine at St. George's University.
Hello, everyone. Thank you for having me, and I'm very grateful to Lake Health and our students who are doing the applied practical experience with Lake Health and this opportunity to discuss non-communicable diseases, which is a very significant cause of ill health in the region, and of course associated with very significant economic and productive outcomes. So it's going to be a very interesting few minutes we are going to be here together. But my task this evening really is just to introduce the topic of non-communicable diseases in the region. So we can go ahead to the first slide. Thank you. So what are NCDs? That's our first question. We have been using this acronym since we started this webinar, but it's really important to have a true definition of this issue. So NCDs are non-communicable diseases. And of course, if we were to group the diseases that fall within that definition, it will basically include any condition that's not caused by or mainly caused by an acute infection, but is associated with long-term health consequences and typically require long-term treatment and long-term care. So this is the definition that PAHO, the Pan American Health Organization, uses to define NCDs. You may have to give it another click, please. Thank you. So when we think of NCDs, we generally think of diseases that fall within these categories here below. And this is not an inclusive list. The definition certainly encompasses many more diseases, but surely in the region, in the Caribbean specifically, and in many other parts of the world, these four come to mind first of all. Cardiovascular disease, they're in the breadth of cardiovascular diseases that exists, chronic respiratory diseases, and very notably, of course, metabolic syndromes such as diabetes and, of course, cancer. And there's a very significant burden of these diseases in our region. And the general trends seem to indicate that some of these are increasing as opposed to decreasing as we would have expected, given the interventions that have taken place over the past few years. Now we can move to the next slide. So what causes these NCDs and what are their outcomes? This is a very significant question. Typically, when we think of our non-communicable diseases, we think about their genetic component, and we can't ignore that. There is a very significant genetic component involved. Persons are likely to be genetically predisposed to developing some of these diseases. The reality is, though, that many diseases, and NCDs included, are typically, the risk is increased, of course, if you have significant environmental and behavioral factors that aren't considered. Now, from the perspective of public health, environmental factors and behavioral factors are considered modifiable risk factors. So we may not be able to change our genes. This is what we were born with. But we can make changes to the context in which we develop, the environment in which we live, and the things and behaviors we choose to engage in, and that can have a very significant impact on our risk for developing any of these previously mentioned NCDs. So the options that we see here on this slide, again, not an inclusive list, but these are some of the important risk factors that we can consider. Tobacco use and alcohol misuse. These are two very significant contributing factors to NCDs. And in many parts of the world, there have been very targeted policies to deal with this, and the effects, the positive impacts of these policy interventions is very clear. They do work. But then there are a lot of other risk factors that probably fly under the radar. So things like unhealthy diet, especially in countries that are developing. So they're now, getting into the phase where they have had significant industrial advancement. There is an increase in their economic well-being and now easier access to food. But frequently, this food tends to be unhealthy options or very processed options that were more popular in developed countries before, but now it's becoming easier to access in these developing countries, leading to unexpected outcomes such as some of these NCDs that we're dealing with. This increase in economic development is also associated with physical inactivity. Persons become a lot more sedentary. These are the lives that we live currently. That is associated with a higher risk of developing all of these NCDs. Pollution. If you are living in a very polluted city, polluted water or polluted air or even polluted soils, you are likely to develop some of these NCDs, including, but not limited to, various types of cancer. And this, of course, is associated with the rapid rates of unplanned urbanization in many cities around the world, in some parts of the Caribbean as well. What is the outcome of all of this? Well, NCDs currently account for 42 million deaths. That is 73% of all deaths globally. And of course, this focused on persons who are less than 80 years of age. Why the focus? Because 80 years and above, well, there is a statistically increased risk of developing an NCD just by age. So that's focusing more on the genetic component. So if you have an increase in persons dying at younger ages because of these NCDs, then we have to keep in focus some of these environmental and behavioral contributing factors. We can go on to the next slide. So what is the impact of NCDs around the world? We can probably pay some attention to low and middle income countries first. Why do we need to make this grouping? Because the truth is there are limited studies in our region. There's a critical lack of high quality data, region-specific research on NCDs and the impact it has on our economic well-being and on our health in our region. So we have to look at studies from around the world and draw the parallels between our economic scenarios and other comparative factors to, assume what the situation is in our part of the world. And there are one or two studies we would look at from some of the larger islands, but there is an overall lack of studies. So we can see that those of us who are working in public health, we do have a priority area to address, which is certainly doing some more primary research on the impact of NCDs in the OECS and in the CARICOM region. But basically, looking at low to middle income countries in general, NCDs currently account for about 77% of all deaths. Now, in the Caribbean, it is estimated that this number is around 75%. So we can see it's quite close. But more importantly, it is associated with very high rates of catastrophic health spending. Again, in our region, we tend to have weaker health systems. We have weaker social protection systems. So that means whenever we have to deal with an unplanned health expenditure, it may be associated with a higher out-of-pocket cost. And that can be, as described on this slide, catastrophic, potentially. There are other impacts, economically speaking. It's associated with a higher number of lost labor days, reduced household income, between 1.3 to 8% of GDP across the region is lost because of NCDs. In Barbados, there was a study that was done, a sort of a pilot study, and it's estimated that they lose on average $75 million US annually because of the problem with NCDs in their country. And this goes without saying. In many of our countries, this is associated and leads to significant gender and socioeconomic disparities. So some of the vulnerabilities that previously existed in these vulnerable groups are enhanced or exaggerated because now we're dealing with non-communicable diseases. So it's a very significant issue. World Bank recently estimated that Jamaica, if they were to increase treatment and focus on policies targeted specifically on tobacco and alcohol consumption reduction, they can save around $640 million US annually. So you can see there's a very significant economic burden associated with uncontrolled NCDs in the region. And of course, this is a region that is undergoing economic development. So we can appreciate that there is a need for prioritizing research and policy interventions in this area. And later on, one of our colleagues is going to focus a little bit on this. Next slide, please. What are the trends globally? Well, this is quite an interesting story because generally in public health, we tend to deal with bad news more than we deal with good news, but we must highlight when there are improvements. And the truth is, globally, NCD mortality has declined in many parts of the world. We must highlight this. And not all across the globe, but in very specific regions, there have been notable declines. And for example, females in Central Asia, the Middle East, North Africa have seen the greatest reduction in NCDs in general. But then there are other regions, for example, the Pacific Islands, that have had the smallest reduction. In fact, they have had increases in certain NCDs, such as diabetes and other metabolic syndromes and cardiovascular disease. The United States, in the grouping of a high-income country, had the smallest reduction in that particular group. And it's specifically due to certain diseases such as cardiovascular disease and certain types of cancer. Now, so whilst there is a reduction, generally speaking, there are specific NCDs that have been seeing increases, and that is very unfortunate. And interestingly, it depends on the part of the world that we are focusing on. So in high-income countries, the issue seems to revolve around neuropsychiatric conditions and Alzheimer's disease and other dementias. That is interesting. Of course, the neuropsychiatric conditions and Alzheimer's have been associated with substance abuse and, interestingly, have been associated with metabolic syndrome. There is a pathophysiological and epidemiological association between metabolic syndromes like diabetes and Alzheimer's disease because they share very similar risk factors and the pathology seems to be very similar. So whilst we are having easier access to medications that ultimately lead to a reduction in some of these NCDs or better control, it doesn't seem to translate to better outcomes in certain presentations of metabolic syndromes such as Alzheimer's disease. So we see an increase in some areas in mortality, but yet we see a decrease in other areas. What about the Caribbean? Let's take a look at the next slide. In the Caribbean, the story is a bit mixed as well. So this is just a snapshot from a recent study that was published. It was published earlier this year, in fact. And whilst they did not have data for all of the islands, there were a few islands that did report data, and they were able to give us a quick snapshot of how we compared in terms of the trend between 2001 and 2010 and the subsequent decade, that is between 2010 and 2019. So I've highlighted on the slides, what you see in red are areas where there have been increases, so a deterioration in progress. So we can see that while there have been decreases, a lot of these decreases in NCDs took place in the previous decade that has been studied. That is between 2001 and 2010. And that is across the board generally, with the exception of Grenada, for example, for both males and females. But in the most recent analyzed decade, 2010 to 2019, we see an overall increase in NCDs trends. In other words, what they're measuring here is the probability of dying from an NCD less than 80 years of age. So the story sort of emulates what's happening around the globe. There have been improvements, in other words, reductions in risk, reductions in the number of NCDs, and reduction in the probability of dying in some cases. But in other cases, there have been increases. What are the causes of these increases in the region? Largely, it's metabolic syndromes such as diabetes and cancer. And to a small extent, cardiovascular disease is also a significant causative factor. What's interesting is that many of the islands within our region are considered to be within different stages of development. So we are seeing some of these development-related diseases as many other parts of the world are seeing. So it leads to a very interesting conversation. Next slide, please. So what are the tips for managing NCDs? How can we stay healthy? Now, later on, one of my colleagues is going to focus on some of the policy initiatives that have been implemented or are being implemented, but each of us can play a very key role, not only in our health, but in being advocates for better health. So these are the 4 things we need to really encourage. We'll start by doing ourselves. So if we don't practice it ourselves, we can't be very good advocates, but we need to do this ourselves and of course advocate for our friends, our family, and those who listen to our message to also implement. Know your numbers. This is key. We have very poor health-seeking behavior in the Caribbean, especially amongst males. We wait until things get very, very bad before we start going to the doctor. But we should know our numbers. We need to do preventive medicine, get our yearly checkups, and know where we are so we can take corrective actions before any of our diseases really start to develop. What else can we do? we need to follow a healthy eating plan. And we need to revisit what healthy eating is. And this is a fantastic image here on the slide because it really snapshots everything we need to do sort of in one slide. It's a very beautiful picture, but we need to eat healthily. And we have been moving further and further away from what can be considered real food and eating more processed alternatives. And that is associated with a higher risk of developing an NCD. We need to stay physically active. And this is key because our jobs are now making us a lot more sedentary. How many times have you walked for the day? This is a very key contributing factor to good health. And we need to get good and regular checkups. And we're talking about across the board health checkups. In our next presentation, we're going to look at one that we probably underestimate, but it's related to some of these very NCDs that we are discussing here today. The point on this slide is that prevention is key. Know your numbers, eat healthily, stay physically active, get regular checkups. Next slide, please. So this approach essentially forms the basis of one of the key initiatives that the Pan American Health Organization has been implementing recently. It is known as the integration of NCDs in primary healthcare. And essentially, it's a package that WHO, or PAHO in this case, as a WHO arm, puts together and provides a framework for more or less the minimum set of interventions that can be used to address the issue of NCDs, but at the primary care level, when you go to your physician. So many countries have implemented components of this. For example, the HEARTS initiative is such an initiative. This was actually led by ministries of health throughout the region. Grenada, for example, did take the lead on this earlier in the year. And this particular initiative seeks to integrate, just what we currently do for healthcare delivery, but have this focus on the prevention and control of cardiovascular disease, ultimately improving outcomes. But the entire framework goes beyond just focusing on cardiovascular disease. It includes management of diabetes. It includes health education, counseling on the misuse of certain substances such as tobacco, cancer screening, the respiratory disease, which sometimes gets ignored under the umbrella of NCDs, is a very significant cause of ill health in the region. This is also strongly focused upon in the framework that integrating NCDs in primary healthcare includes. So this includes very specific strategic priority areas, and the next slide can show us a couple of those. So these are the 6 priority or strategic areas that this will focus on. And the objective really here is to scale up expansion, to have comprehensive NCD services across the health spectrum, but focusing on primary healthcare. But also focus on community outreach, ensuring that everyone has, important participation in NCD services, ensuring that there is very specific guidance that primary care practitioners can use as a basis to deliver NCD preventive care. Workforce development, expanding medicines and technologies, which is one of the key contributing factors to the decline in some of these NCDs in many of the developed countries around the world. And of course, ongoing research is also important, ensuring that we have continuous monitoring of current NCD trends. So this introduces the topic of NCDs in the region, in the Caribbean specifically, highlighting the fact that more research is needed, but the picture is relatively clear. We do have a very significant burden of disease, and it needs to be addressed. But let's pass on to our next presenter, who will develop the topic, and I guess our host will introduce this presenter. Thank you very much for your attention.
Thank you for your informative presentation, Dr. Mitchell. One key point is clear: the burden of NCDs has a global effect. And building on that idea, our next session will focus on a very practical aspect of prevention: oral health. Please welcome Ms. Paula Jankowski and Ms. Sarah Greenberg, candidates from the University of Pennsylvania Dental School, who will highlight how oral health connects to NCDs like diabetes and heart disease, and share actionable tips we can take in our daily lives and communities.
Hi, my name is Paula Jankowski, and I'm a second year at the University of Pennsylvania School of Dental Medicine. Hi, I'm Sarah. I'm a fourth year dental student at the School of UPenn for dental medicine.
Just waiting to see the slides.
Yep. Thank you so much for joining us, everyone. I know oral health is not always the funnest topic for everybody, but we're very, very excited to speak to you guys about this.
Just having a few technical difficulties. We'll be right with you. Okay, hopefully you can see the slides now.
Okay, we can go to the next slide, please. So when people hear about non-communicable diseases, usually it's often in the context of diabetes or cancer, and oral disease is rarely part of that conversation, even though it ranks among the most common non-communicable diseases in the world. Although oral disease is largely preventable, it affects people of all ages, and unfortunately, people in low income and disadvantaged populations are especially vulnerable. But I think the reason we felt it was important to present on this is that oral disease shares risk factors with systemic diseases. So having good oral health can have far-reaching effects on your overall health. Next slide, please. So to put the burden of oral disease into context, oral diseases affect about 3.7 billion people worldwide. About 2.5 billion people worldwide have untreated dental cavities in their permanent teeth, and around 12.5% have severe periodontitis, which we'll talk about more later. And when we look at St. Kitts and Nevis, the burden becomes even more concerning as we have 44% of children ages 1 to 9 with untreated cavities in their primary teeth, which can impact their development and their ability to function comfortably day to day. We have 28.6% of individuals older than 5 years with untreated cavities in their permanent teeth, and 26.4% of individuals have severe periodontitis. So that's a trend that's a bit higher than globally. Next slide, please. So talking about periodontitis, periodontal disease is a severe gum infection that damages soft tissues such as gums and surrounding bone, which supports your teeth. It usually presents with red swollen gums, bleeding with flossing or brushing, bad breath, receding gums, so your gums fall and cause sensitivity. And besides the oral implications of this, it creates a state of chronic inflammation in your mouth, where bacteria and inflammatory mediators are able to then enter the bloodstream and cause systemic conditions. So once this bacteria spreads to the rest of the body, it has been shown in studies that it can impact how your body regulates insulin, and it can damage blood vessels and their function, and basically contribute to the development of other non-communicable diseases. Next slide, please. So two of the most well-studied connections are between periodontitis and diabetes, as well as with heart disease. And this has been shown to be a bidirectional relationship, which means that this having either condition increases the risk of developing the other. And if you do develop it, it tends to be more severe. So the rationale behind this is that individuals with diabetes, for example, have impaired immune responses and delayed wound healing, which can worsen outcomes in your oral cavity and just impact healing there. At the same time, if you have periodontitis, it has been shown that it makes blood glucose levels more difficult to control, which could mean a more severe form of diabetes. And additionally, periodontitis has been associated with an increased risk of cardiovascular disease because the bacteria can travel to the heart and surrounding structures. And individuals with heart disease usually have more severe periodontitis. So we think this is important because oral health should not be seen as a secondary concern, but something that's an essential component of your overall health. Next slide, please. So the problem lies in the fact that there are many barriers to oral health, one of them being access to dental insurance. So it has been shown that individuals with dental coverage usually see a dentist more frequently and are likely to receive preventative care, whereas those without insurance often wait until pain or infection occurs, and at that point it may be too late to treat the conditions. Nutrition is also a critical barrier because if you have a lack of consistent access to nutritional food, individuals will start to rely on highly processed foods because they tend to be more affordable. But unfortunately, they're also higher in sugar usually, which increases the risk of oral disease. Limited access to dental homes and providers means that individuals don't have a dental office where they return to repeatedly and where they have a provider that can spot these diseases early, which allows these preventable diseases to progress to pain, infection, or tooth loss, which is irreversible. And lastly, limited understanding of the importance of oral health can result in poor oral hygiene at home, a fear of dental care, and avoidance of treatment, which can worsen oral health outcomes. Next slide, please.
Okay, thank you, Paula. That was great. So, despite all the challenges that we have here, we can recognize the severe systemic relationship that oral diseases play with all our other conditions, such as diabetes and heart disease. Many of these conditions that we discuss with oral diseases are preventable. So, the key to that really is having early intervention, so semi-annual visits to the dentist to have checkups and kind of encourage good behavior with patients about how to keep their own hygiene and reinforce those daily habits that I think people tend to not prioritize in their day. So just brushing twice a day with a fluoridated toothpaste, and cleaning interproximally and limiting sugar intake. And we really want to clean interproximally in the teeth, and that means between the teeth, because that's where bacteria likes to accumulate. And that's that bacteria that is responsible for these oral diseases. So when it accumulates, it kind of puts you at a higher viral load and a higher risk for developing these conditions if it's left there. So we like to reinforce habits to kind of mechanically remove this bacteria. Next slide, please. So although we understand that there is a lot of limitations in access to care, especially with having a regular dental home, having regular dental visits and providers, there are ways that you can combat that issue. And a lot of what we do, including in our own institution, is having school-based interventions, because that's a perfect common ground to increase everybody's literacy about dental health and just access to certain products. So what we'll do, even if you're not necessarily a dental provider, is we will distribute fluoride-based products. So there's typically something called a varnish that we apply on the teeth. It sits on the teeth and it kind of strengthens the teeth to prevent penetration of this bacteria, which causes the breakdown, which I'll discuss in a sec. And some of those things can also include just going over general oral hygiene. You'd be shocked how many people do not know how to brush their teeth properly and do not understand the significance of flossing. So they don't prioritize that in their daily routine, and then kind of leads to the consequences of bad oral hygiene. And what we like to also do is something called Kerry's risk assessment. It's something that we've taught as dentists and something that anybody can do. It's really to assess the nutritional intake of an individual and determine like if they're taking in a lot of processed sugars or carbohydrates, and frequent snacking. That can kind of give us an indication if they're at a higher risk of developing cavities compared to the normal individual. And like I said before, demonstrating proper brushing, flossing techniques, and something we like to also place, especially for kids, is something called sealants. So something that we can do is we can place kind of a cover on the teeth and fill spots that in anatomy bacteria like to kind of fester into. So like little nooks and crannies that exist naturally along the teeth are perfect hotspots for bacteria to persist. So what we'll do as a preventive measure, instead of waiting for cavities to develop on children, and even some young adults get them placed, is we'll typically place something called a sealant to seal off that kind of groove to prevent bacteria from building up in there and eventually leading to breakdown of the teeth. And something we also like to emphasize is, in addition to those fluoride-based products, is there's many forms of fluoride sources you can have instead of just getting those like varnishes, like I was discussing. So if people drink certain bottled waters, they will include fluoride in it. If they use toothpaste with it, there's mouth lotions that do it. These are all kind of ways that if you're in a community that supplies these, puts you at a much lower risk for these cavities and accumulating this bacteria that's detrimental to your health. Next slide, please. Next slide, please.
I'll be right. Sorry, 2 seconds.
No
Technical issue
worries.
again.
It's okay. I'm the same. Don't worry. Take your time. All right. So we've all established the enemy is sugar in all of our diseases, in all of our issues we have here. Nutrition is a huge component of leading to predisposition for these diseases that we have and is preventable. So the biggest complication, in addition to just having access to all these processed sugars, is I don't think people have a good sense of how much sugar they're taking in their day. Oh, sorry. So, and this surprised me too when I looked up the statistics. On average, according to the UK, an adult individual should have only 30 grams of sugar, which looks to be about 7 teaspoons of sugar. That's less. You would have more sugar in a Coca-Cola can, and it's typically around average a standard candy bar's amount. And there's people who are definitely intaking more of this on a daily basis. So it's a perception of not only the frequency of the sugar you have, but the level of sugar you're having. And I think people don't have a good understanding of what that looks like in their food and need some level of education in a nutritional sense of, well, how much sugar is really in my food in a daily day? And then make an assessment of, well, am I over consuming that? Because if you look on the side here, it's a crazy disproportionate. Like one muffin is your whole total sugar for the day, and we know they're having another muffin, they're having a Coca-Cola with it. So it's understanding of really the relationship there. Next slide, please. And so, why am I talking about sugar so much? What's the role of teeth? The way that it goes is there are bacteria that naturally exist in your mouth. You have a very complex bacterial microbiome in the mouth. And the way this bacteria works is when you expose it to sugar while you're chewing and eating, it'll take the sugar and break it down and expel acid as a response. And this acid will sit on the teeth. And if it sits long time, will break down the teeth. And then this is kind of the process of where cavities will start to form, which is why we really emphasize good home care, because after you eat, people can brush their teeth and remove that acid that's sitting on these teeth and kind of neutralize the environment in the mouth. But if people don't brush their teeth all day long, they're leaving this acid on their teeth for a persisting amount of time, it's breaking down these teeth. And in addition, exposing your body to this bacteria, you'll be swallowing it. So like we were discussing cardiovascular complications, you're going to be swallowing this like accumulation of bacteria that can worsen your heart side effects, can worsen your sugar control because you're swallowing more of this bacteria and it's constricting your blood vessels and creating some level of damage. So this is why it's super, super important that you have good hygiene. And it kind of creates this vicious cycle where you leave this tooth in an unclean state, you're just creating an environment where it's more likely to break down over time. And like I said, with tooth damage, if it reaches a certain level of irreversible, meaning you don't kind of have good prevention, you could potentially lose the tooth or develop periodontitis, which is where the bacteria accumulates in that gum tissue. And then that's a lifetime kind of diagnosis. So once you develop periodontitis, just like diabetes and cardiovascular disease, you cannot expel it. It will be a chronic inflammatory condition like any other ones that they were discussing. So, and then of course, long-time consumption, as we already know, is linked to obesity, diabetes, and cardiovascular disease. But that's the main emphasis here. Next slide, please. So, in addition to the preventative measures, there's definitely ways we can limit sugar intake on our parts here. So, there's a huge impact of sugar taxes that are being introduced in public health. So, sugar-sweetened beverages are the largest source of pretty much most sugars in the USA. And around the world too. So they're very common that people drink a soda and not realize how much sugar is really in it. And there has been shown to be a greater consumption and related diseases in low-income communities and people of color. So it's disproportionately affecting your nation as well. So one of the things that we do, at least in Philadelphia for us, is where we're based in school, is we have a tax which can kind of upcharge how much a beverage will be with how much sugar content is. So if a beverage has high sugar content or classified as a sugar sweetened beverage, there's an additional tax when paying for it. So it becomes kind of less accessible for individuals, and people are less incentivized to purchase that as their source of like daily sugar. So it will decrease consumption, and consequentially, the lower amount of sugar you're intaking in a day, it'll decrease your risk for tooth breakdown or cavities. And then you can use that tax that people are paying if they are purchasing it to allocate towards actual preventative programs. So it's a really, really good secondary approach that people can take in public health to reduce sugar intake. Next slide, please. Yeah. So in addition to all this, it is so much cheaper to preventative care for dental than it is to do long-term treatment for it. So it's much cheaper to have a toothpaste or floss in your daily routine than to kind of neglect that care and ultimately end up with much more expensive work. And as we know, dental care is not accessible to everybody, and can typically come out of pocket. So although I know it seems challenging to purchase, toothpaste, toothbrush, or all these like oral health preventative tools that we have, it will be ultimately cheaper in the long run if you explain to individuals that they take care of their teeth on a daily basis, then allow it to persist to a point where they're paying for these much more expensive procedures. And these can be quite a burden because don't forget we have 32 teeth in the mouth. So this is per tooth situation here. So preventative dentistry also ultimately is more cost effective, especially in these kinds of communities where they're not necessarily having access to care. They deciding to have daily oral hygiene habits and seeing potentially a professional once a year could really save them, not just financially, but in their health. Next slide, please. All right, that's about it. I know that was a lot, but thank you so much for taking your time to listen to us and have us talk about oral hygiene and oral health.
Thank you, Paula and Sarah. Those were some valuable insights on the link between oral health and chronic disease. As we've seen, even simply incorporating some daily habits like brushing, flossing, or regular dental visits can really make a difference in the long run and be a cost-effective measure. Before we continue, we'll take a short 5-minute comfort break. For those who wish to stay on screen, we encourage you to participate in our stretching session I think we're still doing this stretching session. It's going to be led by Jay. Or in the meantime, we would really appreciate anyone for answering our quick poll. What do you think is the most important factor in preventing non-communicable diseases in your community? If you scan the QR code, it'll take you right to the poll link.
Awesome. Well, thank you everyone for coming on and being on with us thus far. Again, my name is Jay Robinson. I'm the project assistant here at Lake Health and Wellbeing, but I'm also a registered yoga teacher and the founder of Yoganics Wellness. So before we continue, I'd like to take just a quick movement break. And you can do this standing or sitting, or if you are laid in bed, you can also do this right where you are. So no worries. But if you are sitting in your chair, I'd like you to place both of your feet on the ground below you and just sit up nice and tall. As you're sitting up nice and tall, I want you to just take a deep breath. I want you to inhale through your nose and exhale through your mouth. But for this, I want your exhale to be longer than your inhale. We're going to stimulate the central nervous system here, work on our vagus nerve. So I want you to take a nice inhale through the nose and then let that exhale be just a bit longer than the inhale. I'd like you to try that one more time. Take a nice inhale and exhale through your mouth a little bit longer. You can have your eyes closed or you can just cast your gaze down. And just take a nice shoulder roll, lifting your shoulders up towards your ears and then slowly lowering them back down as you continue to breathe. We'll do one more of those. Then I want you to take your head and drop it down toward your right shoulder. And then you can take your right hand and just slightly take a little tug onto your neck, onto your head rather. Just give it a little tug. Slowly drop your head to the other side, back to the left, and take your left hand and give it a nice little tug over to the left. Very, very good. You can return your head to center. Give another shoulder roll backwards. And a few shoulder rolls forward. And then let's end by taking one more breath of gratitude in through your nose and out through your mouth. Thank you, guys. Now let's get back to business. Maggie, Sam, I turn it right back over to you.
Welcome back, everyone. Thanks for the great stretching activity, Jay, and thanks to our participants for sharing your thoughts on the poll. It's very clear that prevention is a shared responsibility and that every community member can play a role. Our next session will focus on building advocacy capacity for non-medical leaders. Please join me in welcoming Ms. Renee Thomas, MPH, instructor, and public health advocate at St. George's University, who will share strategies for translating community experiences into meaningful policy action to reduce NCDs.
All right, thank you so much. And thank you everyone for joining us. And I'll be the last formal presentation, so I hope I keep you engaged. And I hope that this is something that you can relate to and we can all get some key insights or lessons, or you learn something new or interesting that could be helpful in our own independent practice. So as introduced earlier, I'm an instructor at SGU and also a public health advocate. And today I'll be talking about policies and programs to support NCD prevention and control, and even highlight some of the work that has been done within our region and some global insights that can help inform where we go from here. So we can start off with the next slide. So what we'll discuss, I'll share some empirical evidence from our region in the Caribbean specifically, and we'll look at some global and regional policy commitments, some strategies for prevention and control of NCDs, implementation challenges within small island developing states, and the role of non-medical advocates. So I'm going to start off. Why do you think policy intervention is needed when it comes to non-communicable diseases? When you look at news or discussions, there's sometimes a debate of whether it's that self-responsibility or the state or nation's responsibility. Is it really individual action, or should it be more of a policy action? And I know we've been talking with you for quite a bit. So I don't know. I just want to open up with a little question, see if anyone's willing to share and why you think policy might be important when it comes to addressing non-communicable diseases. And you can unmute your mic. That's fine with me. You can type on the chat, whichever you prefer. But I would love to hear from someone.
I will share. Can you hear me?
Yes, I can hear you.
Yes. I think policy is important because I think we're all no, that's the wrong thing to say. We're not all educated. I feel like we all know or most of us know what we need to do. I feel like education has been preached a lot, and most people tend to know, yes, I need to eat healthy. I need to, I need to brush my teeth. I need to floss. But from time to time to do with that, our own behaviors and policy and laws and things like that be a way. I think that yes, it might not be agreed upon, but I believe that is something that we need in order to enforce certain behaviors that we want, especially, as we know that healthcare cost is really high and those kinds of things. So if we can implement things like policies, with sanctions if it's not done properly, then we would be more willing to adhere than just doing it on our own.
Thank you for sharing. Thank you for sharing that, and thank you for participating. And I also see some comments on the chat and to make healthcare more accessible and increase health literacy. And we change the context by making the default choice the healthy choice. So I think we're all on the same page on why policy intervention is important. And we'll see some of the evidence that shows how it can make a difference. And of course, context matters. Not all interventions don't always work the same or don't get the same results, but it's important, as Dr. Mitchell highlighted earlier, this is where research comes in. Along with advocacy and our effort, research needs to support decision-making to ensure that we're making some of the right choices. Just to give a brief example, when it comes to policy, that I think you see a lot on social media and discussions looking at cereal boxes. I think that's the most common one I've seen discussed on social media. But because of different legislation in different countries, you can buy the same brand, for instance, of a cereal, and you have completely different ingredients if you're in the United Kingdom versus if you're in the United States. And policy are some of the factors that contribute to those changes, because companies were forced to reformulate their products to be allowed to sell their products within a specific context. So that's how policy can make a difference. As an example, we'll talk about some specific examples looking at the region. But to start off, I'm going to share a resource. I just put it on the chat that if you're interested, you can download it and look at it in more detail. It's a big document, but it's from PAHO, the Pan American Health Organization, that looks at NCDs at a glance within the Americas. So North and South America, including the Caribbean. And looking at country progress towards the global target of NCDs in 2025, I'm just giving you one quick thing that I observed from that document that I think is helpful, because they mentioned St. Kitts and a lot of Caribbean islands, but they identified 5 countries, Antigua and Barbuda, Argentina, Barbados, Chile, and Grenada, out of the 35 member states who are on track, according to this 2025 report, to achieve the global NCD target. Right? So if you want to look at that, you can look at that report. But an additional 11 countries, including St. Kitts and Nevis, Bahamas, and Dominica from our region, can potentially reach a target if they accelerate some efforts. So that was an interesting resource that I thought could give you, if you're interested in seeing some action in what these countries have done that have led to some change and progress and how it's being monitored. But I know we're not here for that detail today, so we're going to move on to have some more discussion on what we're seeing within our context in the region. So we can go on to the next slide and discuss some of the evidence within our regions. We can move to the next slide, please. Oh, thank you. So Barbados implemented an SSB tax, which is SSB means sugar sweetened beverages, right? So think sodas. Now, a lot of people often think these drinks or drinks that should be taxed are just sodas, but it's not just sodas. It's sugar sweetened beverages. So any of them that have that excess amount. So some I won't call them juices, but they often have the label juice drink. So if you see something like juice drink, and if that tax is on it, it's because it passes that threshold of that sugar content. So it's sodas and all of those different drinks that usually fit that category. And they implemented a 10% tax in that first instant. It has since increased and led to the decrease in sales of SSBs and an increase in sales in the non-SSBs. So within Barbados, their research has shown that people buy less of those products as a result of that tax. And that aligned with some observation from Mexico. Because Mexico, I know we're going to focus more on the region, but Mexico has a lot of research that has been done. And it's actually quite an interesting context from my perspective in terms of policy. But Mexico had some very unique challenges that has contributed to really high consumption of sugar sweetened beverages, in particularly in rural communities. And PAHO reports highlight that very detailed. They made an example of in some rural communities in Mexico, instead of water as the first thing you drink in the morning, some young children, they consume Coke. And there are a lot of factors that contribute to that. It's not just, hey, I'm going to give my child Coke because I want to. There are other factors that we often forget that contributes to some of our decisions, such as access to water and clean and readily accessible, clean, drinkable water that's not costly. So some of our countries in the region, including looking at, I'm not sure about St. Kitts and Nevis, but I know some countries do have some water insecurity where your water coming into your tap and not necessarily you're comfortable drinking it because of context and different challenges with it. Now, if you're in a situation where your water is probably not the best for consumption, you have to purchase water on a daily basis, it may not be your preferred choice of purchasing on a regular basis, especially if it costs more than some of these SSBs. And that was a situation that they observed in those rural areas in Mexico. It was cheaper to buy some of those drinks, including Coca-Cola as an example, as opposed to purchasing water, having access to clean drinking water. So SSB tax was something that they introduced to address that, but it's also important to highlight that if the tax is implemented and water is still more expensive, you may not solve the problem. You may just put families into a greater burden, which leads to poverty and puts a different pressure on our society. So in the context of implementing policies, it's important to be mindful of the whole situation. So through my collaboration, through my involvement, I should say, with the NCD commission within Grenada, and with some of our practicum students, actually, we looked at access to water within our schools in Grenada, because Grenada has also implemented some policies that are not enforced at this time to restrict access to SSBs in schools. And to support the enforcement of that, we thought it was important to look at what is the access situation to water in schools. And we had some very surprising findings, which has shown to us that water is not as accessible as we thought it might be. So if you're implementing you're implementing restrictions within school, then what is the alternative that students can consume? And especially in our climate where it gets hot and students are exposed to the heat within our school systems, most of our schools don't have ACs, then that is another problem that we have to be mindful of. So I'm just giving those examples to show that these taxes and solutions can be very helpful, but local context is often important. And that's something as non-medical advocates, I think you can have a great voice in speaking about and showing support for policies that make sense and not necessarily just copy and paste, but can make positive impact. Another example I think that's very helpful was the Jamaica school feeding program. And sometimes within our context, we think of school feeding or nutrition programs as more as a just food insecurity in terms of people not having access to food for consumption, but it also plays a very important role in nutrition. And what they found is that there were improvements in academic performance among children in poor rural areas by providing healthy meals for those children. And that played a huge role in informing how they made decisions about their school feeding program. So from an early age, having access to good nutrition and having policies that support that, you can have a double benefit where children are being exposed to some of the best nutrition that they need to, and good habits that they need to get used to in terms of their future lives, but it also helps their performance in terms of their academic performance and shows the link between, mental health and overall well-being along with your physical health. So I really like to use that as an example as well. And then my last Jamaica example, and Barbados and Jamaica tend to have a lot more data. So if I'm using them more, my apologies, and hopefully it's inspiration for us to do more research in the other islands. But another example from a health financing perspective, the Jamaican National Health Fund has shown to reduce out-of-pocket spending on medicines for persons living with NCDs. And that is a big one because as Dr. Mitchell highlighted earlier, one of the key concerns that we've seen with NCDs is how they contribute to catastrophic health expenditure. And similar to what I talk about the tax in Mexico and how it can have impact on families, not just in Mexico, but in any context, out-of-pocket expenses for treating NCDs can have a huge impact on families, and that can be definitely concerning. So they implemented the National Health Fund, and that has shown to reduce out-of-pocket spending. Now, that doesn't mean it solved the problem. I think there's room to investigate whether the National Health Fund is also leading to reduction in NCDs in the long term in the country. And there's room for further research and support, and even the role of primary healthcare in all of these factors that needs to be considered. But this is just showing some of the different policies that exist that has played a role or contributed in one way or another in prevention and control. So we can move on to the next slide. I'm just highlighting a comment from Dr. Mitchell, and he has some personal experiences from Mexico, but he said, did you know the parent company of some of the common purchasable potable water in rural Mexico is the same company behind the sugar-sweetened beverages? And that's a key thing that we see a lot when it comes to policy. There's often things like conflict of interest, which makes it very difficult within our context to make informed decisions. And that's why research is so important, because if there's evidence that we can use, particularly uncompromised evidence, that quality of research, it can really help us push for some of the policies that we need to support improvement in health. Now, I'm just highlighting some global and regional policy commitments when it comes to NCDs, particularly commitments from a lot of our countries within the Caribbean context. Starting with the United Nations high-level meeting, there's been a lot of political commitments from a lot of our countries. There was a meeting this year, I think around August, and CARICOM was very present and involved within those meetings and spoke and emphasized the importance of NCD prevention and control. Now, we do need to see some of that work leaving those meetings and coming into our communities and making those commitments actionable. But it has demonstrated that at least from policy action, we have seen some action there. The PAHO Hearts in the Americas, which I was spoken about earlier, is an initiative that has been around for quite a few years and implemented in some of our countries. I would say I've seen more reports from more Latin American countries than maybe all the Caribbean countries, but it has started, quite a few, and Grenada started this year. And that is focused around cardiovascular health, which is one of the leading causes of mortality within our region when it comes to NCDs. But another initiative that PAHO has since developed that aligns with the Hearts in the Americas is the Better Care for NCDs that focuses on all the different NCDs that we're affected by and how they all fit within primary care, and really looking at strengthening primary care within our local context, and hopefully with the goal of improving NCD prevention and control. And this is something that they've been working with our region to have some of those efforts. But before I just talk about those a little bit, I'll also speak about the CARICOM Port of Spain Declaration, because I think it's an important context. And there's a declaration from CARICOM, I should have noted the year, but it was early 2000s, where they agreed to some key strategic areas to support NCD prevention and control. And that is national NCD strategic plans. So quite a few countries have established those. I know Grenada had one, and I'm from Grenada, so my apologies if I know a little bit more from that context. And the establishment of local NCD commissions. So quite a few countries do have active commissions within their context, and also the establishment of the Healthy Caribbean Coalition, which I know is a key partner of Lake Health and Wellbeing as well. And they actually have a website where they track some of those commitments from the Port of Spain Declaration, that if you're interested, you can go to the website to see, okay, which countries have an NCD commission, which country has childhood obesity policies and things like that. So they've played a role as, I guess, an overarching CSO for the region to track some of those commitments. But they've also been involved with PAHO in some initiatives, such as the Better Care for NCDs initiative, particularly working with CSOs or civil society organizations, because civil society organizations are a key powerhouse that I've recognized that can play a very major role when it comes to NCD prevention and control. Because often these CSOs are aware of information that you would not hear in a clinic, or you would not hear anywhere else. I like to give an example. I actually recently encountered with a CSO, was hearing one of them speak about the experience of a patient on our public transportation system. I think some people are on the call, so they might have remembered that meeting. But we're thinking from a policy perspective, or from whether you work in the Ministry of Health or you work in a clinic, you may not necessarily think of all the other areas that people live in with NCDs. You may not think of all the other areas that they may need support. And one of the things was highlighting the role of, or the importance of, our transportation employees, whether it's public or private, being knowledgeable or being aware of how to support patients if there was a moment of distress or medical emergency within while on our bus system or whatever public transportation system. So those are some key insights that you can gain from CSOs that often you may not get in other contexts. And that's why having CSOs involved in some of these involvement, such as being involved with some of these organizations, such as HCC and other initiatives, is also key in terms of the overall goal of prevention and control. So I've been speaking for a while, so I'll move on to the next slide on specific interventions, all right? But I'll highlight 4 major modifiable risk factors. I know Dr. Mitchell touched on some, but some of the 4 major modifiable risk factors, the other 2 is on the following slide, that we've seen are tobacco control, harmful use of alcohol, unhealthy diets, and physical inactivity. And as Dr. Mitchell acknowledged earlier, tobacco control and harmful use of alcohol are some of the things that there's been more effort compared to the others in terms of prevention and having some control and how we can address some of the challenges. But there's room for further improvement within our regions. I think I have some examples that you've seen in other contexts. We tend to have taxes already, but things like smoke-free areas, bans on marketing typically exist in a lot of places. Age restrictions typically exist in a lot of places, but these are some of the typical interventions that you see when it comes to controlling tobacco. Harmful use of alcohol in the Caribbean context, I think, is one that requires a lot of stakeholder engagement, because we have a lot of interest, I should say, or competing interests when it comes to alcohol consumption. And studies have shown that we do have high consumption within our region and some of our countries more than others. So things like restrictions on advertising and sponsorship are solutions that other places have explored. Enforcement of drunk driving policies. So not just implementation, but enforcing it. Enforcement of age restrictions, banning of the sale of alcohol at school events, outlet density regulation, which sometimes is a bit challenging within our context because we don't necessarily use a lot of GIS or geographic information systems in some countries. Others may do it, but what that means is not having more than X number of outlets per geographical area distribution, as well as taxes or increased taxes. So those are some policy interventions that can be looked at or explored when it comes to tobacco control and harmful use of alcohol. But I'm going to move on to the next 2, which is unhealthy diets and physical inactivity. I'll spend a little bit more time on them, but not too much time. Just because within our context in the region, I think there are some unique challenges within small island developing states, particularly in the Caribbean region, which may make some of them a little bit more challenging or need more thought or creativity for successful implementation. So some of the key ones that other countries have implemented, and Mexico and a lot of Latin American countries have successfully done actually, and there's a lot of evidence from them, are things like the sugar, sweet, and beverage taxes. And some countries in the Caribbean have done it. So Barbados, Grenada, Antigua recently announced, I'm not sure if it's fully implemented, but Antigua in the near future, and other countries have some SSB taxes. front of package warning labels. If you visit Mexico, Colombia, quite a few Latin American countries, you would see that they have those black octagonal warnings that says high in sugar, high in fats, high in all the different things that you should be aware of at the front. So no need to go to the back and read the label and try to figure out whether this is healthy for my consumption or my family's consumption. So those are some of the things that have been implemented, and the results from those countries have shown to be very effective. That is something that was championed amongst CARICOM at least twice, but unfortunately it hasn't been successful yet. Maybe it might be in the near future, but I recall that Barbados has said that they're committed to doing it. I'm not sure whether it's on their own, whether or not other islands may follow. We're not too sure. But let's see what it's like, and maybe there might be evidence from Barbados that could inform other countries to follow the path once implemented. Now, school feeding programs, as I mentioned from Jamaica, can be a key policy. A lot of schools have school feeding programs, but there's room for more emphasis on nutrition as opposed to just giving children something to eat during the day. Because creating healthy diets and practices from an early age is such an important, and I think sometimes unappreciated aspect, because you're grooming, in a sense, habits and creating habits from an early age. And if nutrition is practiced from schools every day in the homes, you can really help the next generation to grow up with a palate that is more appropriate as opposed to some of the palates that we may have been exposed to growing up as we're trying to make this transition. Ban of trans fat, that's a campaign I've seen throughout the region. There's still some debates on, or still some advocacy, I should say, in terms of banning of trans fat. So, and then the next two, which I think can be a bit more complex within our context due to, I guess, numerous challenges as developing countries and small island developing states, are things like calorie displayed labeling. And the reason why that can be a challenge, it will be a cost for restaurants or vendors or different people who may need to do it. And particularly smaller facilities may be at a disadvantage. So some of these interventions, as I said, within that context, it's important to be mindful, have a lot of stakeholder engagement or support from the government or whoever is able to support with the implementation of some of these potential policies. Same thing with cup size restrictions. It could be a cost, maybe a little bit easier or less challenging than the calorie display labeling. But I know from the US, there was some pushback in some states, so there might be some lessons learned in terms of if you want to do cup size restrictions. But I must admit, I'm not too familiar with the cup sizes that are common within the region. So I cannot verify if we do have those huge sizes because, I don't usually purchase those things. But it could be another policy that could potentially be a way to control our consumption of SSBs. Now, the physical inactivity is one I think is particularly challenging for some of our islands that are more mountainous, like Grenada, Dominica, who we do have some infrastructure challenges that may limit some of our capacity to have more things like parks and sidewalks and safe public spaces. But safe public spaces are such an important aspect of promoting physical activity and supporting physical activity within our context. So a parent may feel more inclined to walk their child to school on a daily basis if there's a safe sidewalk, if the school is just 5-10 minutes away, rather than drive them because of the noise, the road, and not just feeling safe on all the vehicles. And that requires a lot of engagement, not just with health, not just with one or two other ministries, but that's really a health in all policies. That's a Ministry of Infrastructure, Ministry of the Works, Ministry of Health, everybody, environment coming together to really say, how can we make some strategic decisions about improving safe public spaces? Similarly, physical activity standards within our schools. Some of our schools have physical activity once a week, maybe twice a week. So how do we look at our curriculum? How do we engage education, Ministry of Health to make some standardization where every day there's physical activity within the school curriculum? So that doesn't mean it's the same one. We could get creative. Maybe they do dance on Monday, they do gym, some other activity. There's so many sports. It could be tennis, but really putting it not as extracurricular activities, but co-curricular activities within the school and accessible and affordable, so no extra cost to students to really support physical activity. But that also requires a lot of engagement and infrastructure support. If you want to do tennis in schools, then you need a tennis court to be within a reasonable distance, right? So they might need some concerted effort to think about what are feasible, practical, and affordable solutions that can get the same benefit, but ultimately want to improve physical activity on a daily basis within our schools, within our school curriculum to support movement regularly for our children. Again, building healthy habits early. Also, things like active transportation policies, which aligns with the safe public spaces, but things like walking path, cycling path, things that encourage or promote more active transportation. So if you're familiar with a lot of developed countries or cities, within the last 10 years, you see some of them went from 4 lanes to 2, and they made bike lanes. They converted some of the lanes to bike lanes and encouraged people to bike more. And the amount of people cycling just increased because now there are safe spaces to cycle. So how can we explore unique policies within our limited infrastructure to support some of that? And again, I do recognize that some islands may be able to do that easier than others, based on the geography of the countries. And last but not least, workplace wellness programs. So programs that support physical activity within the workday to encourage physical activity. And I want to also add, and we can go to the next slide. With all this being said, mental health is such an integral part of NCDs and prevention and control because it's deeply, deeply intertwined, as conditions like depression and anxiety increase the risk of developing NCDs and also undermine adherence to treatment. But also, some studies have shown that people who are living with NCDs also develop mental health challenges within the process because it is a stressful and could have a lot of toll on any individual family. We talked about the economic burden and all the other factors that contribute to it, and again can undermine adherence to treatment. So whatever the policies that's involved, the approaches that are taking, integrating mental health into primary care, strengthening psychosocial support, and reducing stigma are key to ensuring that we have people-centered NCD cares. So having mental health being incorporated within our primary healthcare centers, which I think some countries are now transitioning to, but it's not the norm currently, is equally important when we look at NCD prevention and control. So moving on to policies for detection and control. I know we have to wrap up soon, but where do we go from here? It's important that we look at strengthening primary health care because that's the start, where everything starts. So being more cohesive in how we operate. A lot of times, through a lot of our islands, private healthcare facilities are not connected with public healthcare facilities. So I could go to a private doctor today and go to a public doctor tomorrow, and they're not talking to each other. My records are not accessible in both places. So and then you also see if someone within our context in the Caribbean in particular, some of our physicians, healthcare providers practice or learn in different places. So if you practice in the UK, or you practice in the United States, or you practiced in Cuba or in a different context, your approach to things may even be different, right? So standardizing screening protocols, integrating NCDs and mental health, using digital health and surveillance tools to kind of share information, having national registries that everyone is pulling and using from can really help us to support better detection and control. It can also help with improving access to patients, because now if I can easily pull up my records all in one place, and let me not forget the importance of even integrating pharmaceutical services. So if I lose my prescription from 6 months ago, I should still be able to get access to it somewhere, have that record, and discuss it with my physician if things change. So really integrating all of our records into shared spaces, and I think digital health is a key way that can help. I know sometimes it may be a costly venture up front, but it's definitely something that we can explore. And without being, of course, everything costs money, but health financing is a key area that needs also to be looked at. And reducing that catastrophic expenditure for families and improving access to medicine and diagnostics is very, very critical. Because what we see, unfortunately, sometimes is that people delay care or don't seek care as they should as a result of the cost. So without without going on the point too long, I mentioned some of these earlier, but moving on to the next slide, there are implementation realities in small island development states that we have to be mindful of. Financial constraints. We do have capacity and financial constraints. Human resources is something that we struggle with and not accessible as small countries. We often have fragmented governance. So what happens in one ministry may not necessarily talk to another. Enforcement, as a result, tends to be a challenge. Limited research, limited empirical data, and even political will are some challenges. But there are enablers. So it's not all doom and gloom. We do see some political commitments, and some countries have made some significant progress when it comes to the commitment that they're making. I made example of Barbados with the commitment to do the front of package warning labels. CSO advocacy, so advocacy from civil society is key, and that can really support or push some of these policies and solutions that we can potentially explore. Greater collaboration, recognizing that we're individually may have challenges, collectively we may be to support and help each other. It won't be perfect. There will always be nuances that we may have to deal with, but it can definitely strengthen some of our weak areas. And just emphasizing the importance of using data, having more research and having more information so that we can make informed decisions. And last but not least, the last slide, just all of you here, thank you so much for being here. Well, what is your role as a non-medical advocate? I think it's important that non-medical advocates are involved because NCDs affect all of us, whether you're a physician or you're a dentist or you're not a healthcare practitioner at all, it affects each and every one of us. The numbers are alarming in our region, so quite most of us probably know someone who is living with an NCD, and caregivers equally, as well as people living in NCDs, have some challenges that often need support, and NCD prevention and control have to consider all of the individuals that are involved, including the impact on our workforce and our productivity as overall communities and our longevities of our countries. So amplifying community voices, driving policy change through advocacy, building partnership, supporting behavior change. These are all some key roles that non-medical advocates can play in strengthening and playing a role in NCD prevention and control. So that's all for me now. And thank you so much for being here. I hope you learned something new or interesting today. And I really think this is important when it comes to driving change, because individual behavior is important, but policy is critical if we really want to see improvements and change. Thank you.
Thank you, Ms. Thomas, for that very keen presentation. I enjoyed it greatly, learned a lot. As we learned tonight, advocacy is not just about awareness, it's about turning knowledge into real change within our communities. I'd like to take this time now to open the floor for questions, comments, and reflections. Please feel free to submit questions in the chat or raise your hand to speak. So we'll get started with that. So there's a question in the chat. As discussed, mental health plays a key role in development, maintenance, and exacerbation of NCDs. Everyone in this presentation emphasized the importance of prevention. However, unfortunately, from an insurance standpoint, psychological intervention is not covered from a prevention standpoint. What can we do to contribute to these efforts in spite of these barriers?
Should I answer since I spoke on mental health? Or
Yeah, go right ahead.
So yeah, that's a very important comment. And, it's every country has its own approach to different things. But I agree that advocacy might be the first step when it comes to pushing for coverage when it comes to mental health services. And within the Caribbean context, it gets tricky because often private health insurance, most islands don't regulate private health insurance to any great extent. So what they do and do cover is often up to them. So legislation may be a key way to kind of enforce covering things like mental health, but also advocating for within the public sector to include mental health in the primary care facility, taking away the stigma. Like if I go to a clinic, I should be able to get mental health support just the way I get any other health support because mental health is health. So I think those are some of the things that we can advocate for. But I know there are some mental health organizations within the region. So maybe coming together as mental health organizations, you can draft a policy or a policy brief or like policy recommendations and get to go to your, as a CSO, amplify your voices in the community and advocate for your legislators to at least look at it and have a discussion to see what are some potential solutions. Because often you have to negotiate. They may not do everything, but maybe you might get some small wins.
Yeah, and if I may add to that, I think that's a very good question, and I agree with Ms. Thomas's perspective. And I think integrating mental health care into that integrated NCD prevention toolkit that primary healthcare practitioners are expected to use would help normalize mental health care. And that may play a key role in breaking down those initial barriers and ultimately expand its incorporation into, insurance providers, protections, and so forth.
I actually had a question that I was thinking about what for both Dr. Mitchell and Ms. Thomas. In the US, we've seen I don't know what's going on outside. I don't know if you guys can hear it. Apologize for that in advance. But okay. All right, that's over with. Sorry about that. Um, in the US, we've seen that a large shift from traditional tobacco products to electronic vapes. In your opinion, are these products a major problem in the Caribbean region? And are there measures that could be implemented to dampen their widespread adoption, especially in younger populations that would otherwise be adverse to smoking traditional cigarettes?
Well, I can take a first stab. This is anecdotal because I don't have the evidence, but it seems as though these alternative tobacco products, these vaping products, are more popular at this stage than tobacco was in its infancy in the Caribbean region. So in the Caribbean, smoking cigarettes was not it was not seen as normal and common behavior as it was in other parts of the world. Whereas that barrier does not seem to exist for vaping products. It's becoming very, very popular. And I think now is the time to really increase awareness as to its toxicological impacts, because there is the underlying assumption that it is a healthy alternative to smoking cigarettes. So it is becoming an issue. Ms. Thomas, do you agree with her from what you've
Yes,
seen?
thanks. Yeah, and from perspective as someone involved in the commission, the NCD commission, um, our drug control secretariat in Grenada has acknowledged that it actually is a problem within our schools. So they are seeing, teachers are reporting that they're seeing it within our schools in Grenada specifically. And unfortunately, they're often sold as bubblegum or some attractive flavor that targets young children. So it's definitely is a problem. There's been a lot of debates. I know, I think Trinidad and Tobago, some countries are exploring just adjusting the existing legislation because I mean these companies are quite interesting in that you cigarettes are losing popularity, so you find another product. So what some countries are thinking, maybe we tweak the existing tobacco legislation to say tobacco and related products, whatever that language is. So rather than every time something comes up, you now have to create new legislation. Hopefully it covers long term. But of course, something else may come up. But that might be a short-term solution that's easy to amend. So that way children hopefully cannot purchase it over the counter with the absence of legislation that you can do and require things like ID rather than a whole brand new policy.
Thank you for that insight. Just a follow-up to some of the proposals. In New York State, where I'm currently based, we actually have laws in place that make it illegal to sell flavored vape products. The fun workaround for that is that they just import illegal vapes and sell them anyway underneath the counter. So it's a definitely becoming a difficult and tricky situation where no one's 100% sure how to stymie this flow of these flavored vapes, and they are very appealing to children. So any progress in that field is good progress in my mind.
Yeah.
Not to
Anyone
mention
have?
the oral health implications of vaping. Not good.
Exactly. I think I see a question from Dr. Ford.
Yes, Dr. Ford.
Yeah, just to lend my 2 cents to the question that Samuel has raised. It's an area that I've been doing some research in. And to echo one of the themes that I think Ms. Thomas brought out is in the Caribbean, we continue to battle with the issue of a lack of information. So I have done a survey of medical students, and I can tell you, since several of you have come through SGU's School of Medicine, data indicates at as high as 30% of those who are going to be doctors or are doctors already have vaped and are currently vaping. Anecdotal evidence is showing that vaping this is just information from my son who attends high school, is that it is appearing in some of the what I would call the upper class schools. So there might be an economic angle to this and also an education. Vaping is not quote unquote as popular because it's not known. And there are not as many avenues where you could go. Like I was recently in Costa Rica where just walking down the road to get something to eat, there are a couple of vape shops. I have not seen that here in Grenada and in some of the other islands like Trinidad, though they may start to appear. So it suggests if we want to head this off, where like in the States and other countries where vaping has taken a hold and the perception that it is safer, a lot of evidence is now showing that no, vaping is just another way of leading to addiction, leading to a whole host of problems. It may not have the same toxicological profile as tobacco smoking, but it has a toxicological profile that is harmful. So, disabuse the idea that it is somehow better if you vape than you smoke. We'll take data to prove that. But policies, putting in place policies where you start either changing the laws to include vaping. And in fact, many journals consider vaping as an alternative tobacco delivery system. So, but the industry keeps moving, so you can get gums and you can get different ways and pods. And so you have to keep up with either by broadening the language to just say that if it is nicotine or it's something that is potentially addictive, we want to control that or put a tax on it or even put laws that say you can't have access to this. So all of that is a long-winded way to say that vaping has arrived in the Caribbean. We need data to see how far its tentacles have spread. But there are things that we can proactively do now to head off this becoming an entrenched problem where now we have to, with tobacco, have to try to educate people on the risk and so forth. Better to prevent that from happening in the first place. So stay tuned.
Mm-hmm.
Thank you. And I see we have a question from Jeremy in the chat. So Paula and Sarah, how do you think collaboration between medical and dental providers can improve patient outcomes?
I can start and I'll let Sarah chime in later. I think that this is key to promoting oral health. I think in many, as dental practitioners, we are supposed to go through our patient's entire health history. And because nearly every single aspect of that is somehow linked to oral health or the outcomes of the treatments we have, whether that's implants or whether cavity fillings will last for years to come. And I think it would be important for that to go the opposite way. I think, if anything, oral health is often seen as a secondary concern, as I mentioned before, and people are much more likely to visit their primary healthcare practitioner than they are a dentist on an annual basis, assuming that there's no acute pain or infection or anything like that. And if we found a way to integrate even some risk assessments for oral health into primary care, then I think we can see better outcomes both systemically and orally. And I also wanted to add that we learn a lot about how many non-communicable diseases or any types of diseases often the earliest signs are seen in the oral cavity. So, for example, osteoporosis, you'll start seeing tooth mobility and tooth loss, or if you have some sort of immunodeficiency, then patients will often present with ulcers or lesions in the mouth that don't heal. So yeah, I'm gonna pass it to Sarah.
Oh, well, Paula covered a good amount of it, but I think that ultimately, at the end of the day, we're all healthcare practitioners in some capacity. We all learn how to deal with the entire body, and it's all connected. So every presentation you'll see in the physical sense, you'll see intraorally as well. Just like how Paula was highlighting, a lot of early detection and a lot of systemic conditions presents orally first. So for non-healing ulcers, that's a big sign that we might consider if they're diabetic or if they're having another systemic issue that's preventing the healing. Kind of the first sign you'll see in the mouth is that, for example, Crohn's disease. Some of the earliest indications of that are intraoral presentations. So there's a lot of systemic presentations that your mouth can tell about the body and about how controlled your level of sugar is too. We'll see a lot of diabetic patients come in who have an uncontrolled level of sugar, and you'll see it first thing in the mouth. They're bleeding way more. There's just a lot more systemic presentation. You'll see a lot more wear on the teeth. And then we will say, when's the last time you checked your sugar? So it's kind of, there is already on its own a multidisciplinary approach between the professions. And I think with patients, it's much easier to hear multiple practitioners telling them, hey, you need to really check on this systemic presentation that you're having. Hey, I see that your blood pressure is high. Hey, I see that your sugar is running a little high. You need to have that intervention done. So it's really important that we work together to kind of reinforce that intervention for patients so that they can get that consistent care.
Definitely. Thank you. And I've also realized just at my last dental visit, I actually had my blood pressure taken. So I think they're starting to integrate a lot of these things. So that's great. And now I see we have a question from Maya. I have also heard that Zyn products are newly emerging alternatives to vape products. Paula and Sarah, can you please speak to the impact on oral hygiene and related medical concerns as a result of such chronic use?
I can touch on that really quick since Paula took it the first time. So Zyn is an alternative nicotine product. The issue with that is the way that they administer it is you're resting it in the soft tissue of your mouth. And it is ultimately still depositing nicotine. Nicotine, it does decrease blood flow, so it actually can cause some tissue death around this. We do see patients who present with a lot of recession. It also causes dry mouth. So one of the biggest kind of perpetuators of cavities is dry mouth. So bacteria love a dry environment where they can thrive in. So this actually worsens your case for cavities, tooth breakdown. The recession means like you'll lose gum tissue that's protecting your teeth, and recession's permanent. So whatever loss you have, you cannot regain. So there are a lot of permanent consequences of that. And some of them do have flavors to them. Again, that's sugar. So you're just putting sugar directly on your teeth and sitting for it with hours. So chronic use ultimately just leads to worse intraoral consequences instead of just trying other alternatives to quitting.
Sarah answered that beautifully.
Thank you. Does anyone else have, oh, I see we have another question here. Oh, not a question. Oh, it is? Okay, yes, it is. Okay, so I'll start at the bottom. So education is paramount to ensure individuals understand NCDs. What measures, models of education, or knowledge dissemination do you think may be worth looking into? And then I know it was stated that many people may view that measures are mundane, sorry. So I assume repetition and patience are important to build lasting habits. I assume that question is open to anyone.
I can touch on this a little bit. Just in terms of the last part of that question, I think with patients, we're taught that, for example, if a patient's coming in and they're showing signs of excessive bleeding in their gums, that usually indicates that they might not be cleaning interproximally or flossing. And what we're taught is to, instead of going to these patients and telling them you have to floss every single day, or if they're not brushing their teeth every day, twice a day, you kind of want to start with something like, why don't we try 3 or 4 times a week? And there are also easier alternatives to flossing because some people don't like the string floss. And so I think it's important to just take anything you can get and slowly build those habits, because anything is better than nothing.
And I really think, in addition to that, we must never forget the importance of educating our policymakers, because ultimately we want to change the default context, as a comment that was made earlier on. We have to make the default choice the healthy choice. So our policymakers have to have a clear understanding, not only of the negative impacts of poor policy on the health of the population, but on the bottom line of the country. It is economically more feasible to practice good preventive medicine, because it avoids some of those larger catastrophic costs that not only impact the patients, but also the bottom line of the country. So I think a lot can go into public health practitioners focusing their attention on policy education so that we can change that default context.
Yeah, to piggyback off of what Dr. Mitchell said, I think also, well, as you educate policymakers, also advocating for, educating the importance of strengthening primary healthcare. I think within our region, in particular in the Caribbean, there's a lot of room for improvement. Generally, we've seen that even that annual recommended visit to a practitioner is not as enforced as you may see in developed countries. And even though we have health centers that generally are free. So looking at our existing primary healthcare structure might be tedious, but seeing how we can enhance it to have more engagement on a regular basis with our patients so that annual visits is a norm and not the outlier, then when people come in, that's an perfect avenue for communication, because now if they're coming in not just because they had some actual acute situation that needs addressing, then you can have those discussions. Hey, have you been to your dentist as well? If things are looking good, this is all some of the things that you need to do. Here's a pamphlet. If things that we've seen in Grenada, and I'm not sure if it's other countries as well, but things like pap smears were not being done as should as you see in like developed countries. And we know cervical cancer is one of the leading causes of death, mortality in among our women in Grenada as well. So how can we incorporate that into primary healthcare? So I think it may need a lot of aggressive effort into starting from there. And from there, you can just disseminate information and engagement. I think digital tools are great. Everybody sending reminders for appointments. I think there are lots of good examples from countries like the United Kingdom that we can learn from and adapt for our context, particularly when it comes to primary healthcare.
Thank you for that. Do we have any more questions? Anyone in the chat or would like to raise their hands? Okay, I'll give 10 more seconds. Okay, I don't think so. Sam, if you want to take over for the next part.
Right. So before we officially close, I'd like to share a few quick items. Like I said at the start, we would post some information of where you can find the recordings of this presentation. But before you do, we have one more quick QR code survey, just a general uh, post-webinar survey where you can leave us some feedback, just to let us know how we did. We truly value your input. It'll help us improve for future webinars and resources for community advocates. Uh, I'll just let this hang out on screen for a second. All right, and after this slide, there's going to be links to all the webinar materials, including the slides, recordings, and supporting resources. They will be available on the Lake Health and Wellbeing website and on the YouTube channel. We encourage you to revisit these resources and share them with your networks to continue spreading awareness about NCD prevention.
Yep. And I just wanted to thank you all for joining us this evening, for your active participation. Thanks so much for all the questions in the chat. And your engagement reminds us of the incredible potential that each of you has to make a real difference in your communities. And we also just want to extend our greatest gratitude to Jay and Abby at Lake Health and Wellbeing for their mentorship, guidance, and for creating this opportunity to collaborate. Developing this webinar was a very meaningful experience, and we hope that tonight's session has inspired and equipped you to take actions on NCD prevention and advocacy in your own communities. Thank you.
Thank you.
Thank you, Sam and Maggie, and to our speakers, Dr. Mitchell, Ms. Paula Jankowski, Ms. Greenberg, and Ms. Renee Thomas. I thank you for coming on this evening and sharing with us. And just a few things for our attendees as non-medical advocates. You guys do play a pivotal role in NCD prevention and management. And just some of the highlights that I gathered from the webinar today, because all the speakers gave such wonderful expertise in translating these complex topics. But as non-medical advocates, your voice is very important. So one of the things that you can do is to support evidence-based advocacy, like Healthy Caribbean Coalition, your local diabetes and heart associations, and also here at Lake Health and Wellbeing, we have many opportunities for the community to get involved. You can also engage your policymakers during public consultations, things like panel discussions and town hall meetings. And because we spoke so much about dental health, and you can just make sure you educate your family on the importance of dental health and how it connects to NCD prevention. And we can support local tobacco control units through the Ministry of Health coalitions and support local tax laws. And one last thing that you can do, because we do know that creating change means you have to be the change. So one of the things that you can do is support local walking groups. You can start one in your church, you can start one at your place of business. And as a family, you can do these things, even choosing water instead of SSBs. You can also, because we do know that things in the Caribbean can sometimes be limited, you can do virtual movement classes. So the change does start with us. Again, I'm very thankful to Maggie and Sam, our practicum students. They have been instrumental in researching, organizing, and coordinating this evening's session. Their commitment to public health and advocacy has been evident throughout this process. It has been wonderful to work with them and talk with them and gain their insights and just hear their suggestions for this webinar. I was very excited to hear what they wanted to present. So we're grateful for their hard work and professionalism. Lake Health and Wellbeing will continue to offer opportunities like this to support non-medical advocates across St. Kitts and Nevis and the wider Caribbean. And we hope today's session has not only increased your understanding of NCDs and policy, but also remind you that your voice matters in shaping a healthier community. So thank you again for your time and for your engagement and for the important work that you do every day as a non-medical advocate and we wish you a very pleasant evening. Thank you.
Thank you.
Thank you. Have a good night. Thank you.